According to the American Heart Association, more than 5.1 million people are affected by AFib. But now there's a new treatment for AFib called the Cryo Procedure. Here to talk about the Cryo Procedure is Dr. Evan Giedrimas. Good morning. Thank you so much for coming on the show.
Good morning. Thank you for having me.
Well, first things first, how do you pronounce your name?
Sure. It's Evan Giedrimas.
Okay, great. We just wanted to make sure we clarified that because it's a little bit complicated. Oftentimes you're called Dr. G. We probably should just stick with that.
That's fine.
But after that, we also want to know about you and your background. Can you tell us a little bit about your experience as an electrophysiologist and how you came to do that?
Sure. Electrophysiologist is an advanced specialty within cardiology. It's a heart specialist that focuses on treating abnormal rhythm or electrical problems that originate from the heart. And it entails several additional years of training even after you're a fully qualified cardiologist. That last step, for example, for me was in Chicago, Northwestern University. So since then, I've moved down here to Pensacola.
And we're happy to have you in Pensacola in our community.
Certainly.
So let's talk about why you're here. You're here to talk about AFib and atrial fibrillation.
That's
Having
right.
kind of difficulty with some of these words, but can you tell us a little bit about that?
Sure. Atrial fibrillation has really become the most common electrical or rhythm issue that we see both in the office as well as in our procedure room. That has to do, a lot of it is understanding how the AFib comes about, and it's often correlated as our population is getting older. You're going to see more atrial fibrillation. So one of the strongest predictors is age, hypertension, heart disease, diabetes, and other sort of risk factors play a role. Alcohol, obesity as well. What it is, it's an abnormal electrical rhythm that comes from the top of the heart, and instead of your heart pumping regularly, it kind of causes to quiver. It's sort of rapid firing from different areas of the heart, and that quivering does not allow the heart to empty completely, and as a consequence, you have some blood that pools there. And whenever blood pools there, a clot can form, and if that clot dislodges and travels to the brain, that's going to result in a stroke. So that's really the biggest sort of concern about atrial fibrillation, is the risk of stroke.
Well, and sometimes these things can be kind of hard to identify, and it sounds like a really scary thing that you want to know is happening to you. So can you tell us what some of those symptoms may be?
Sure. And that's sort of the second aspect of atrial fibrillation, and it runs a whole gamut. So some patients are completely asymptomatic, and that's normal as well. Some patients are quite symptomatic and can present with lightheadedness, even passing out or syncope. They may feel an anxious feeling in their chest, what we call palpitations and fluttering. Shortness of breath and fatigue are also very common as well. But again, that's usually, if you experience those symptoms, the ultimate way to confirm and diagnose atrial fibrillation is seeing your doctor and getting an EKG, which is the ultimate diagnostic tool to make sure you have it or not.
Well, and especially at some point in your life, realizing maybe it's time to have some regular checkups, because again, the symptoms may not, of course,
be present. Correct.
Right,
absolutely,
exactly.
Absolutely. So yeah, your yearly EKG is going to be a great sort of tool to make sure that nothing's happening, especially as you get older. You know, that certainly is advised and recommended.
Right. Well, so how is someone diagnosed with this?
So in addition, to the EKG, a lot of times we can have patients also wear a monitor, a 24-hour monitor, or even sometimes if patients only have the symptoms of palpitation and racing heart sensation once a month, we do have monitors that you could wear for once a month. And we even have little implantable devices that are good for up to 3 years if we really want to make sure or evaluate if patient is having atrial fibrillation or not. So there's multiple different devices. There's even an iPhone-approved FDA device that will kind of tell you what your rhythm is and whether it's atrial fibrillation or not.
That's pretty incredible.
Yeah.
But also kind of scary to think that you need to rely on technology for your life.
True, true.
A little scary, but really neat that we've progressed to that point. But tell us a little bit about the cryo procedure.
Sure. So depending on symptoms of atrial fibrillation, a lot of times some people that find it bothersome or concerning or impacts their quality of life, we a lot of times approach it in a stepwise fashion. First, we offer medications that prevent the next bout of atrial fibrillation, but a lot of times, and this has to do more due to the progressive nature of the disease, even the medicines don't work, and that's when we talk about an ablation procedure. Ablation procedure is a procedure that targets these abnormal areas that misfire and causing that quivering in the top of the chamber. It can be done both with freezing or heating. Radiofrequency is the heat, and in this case, cryoballoon is the latest technology that's available. Again, that's done with freezing. It's a pretty good sized balloon, about this big, where it gets inflated, but sort of large grape, small plum inside your heart, and kind of abolishes all the electrical signal where that balloon comes in contact with by freezing the nearby issue. Again, it only affects the electrical issues. Your heart's still going to beat normally like it does, but it really works well to control the symptoms of atrial fibrillation.
Well, and of course I would assume that this is not the only treatment for AFib, but why is the cryo procedure the preferred method, or maybe even a better method?
Sure. Well, again, is the latest procedure that's been developed, and it really was the tool was developed with a purpose in mind, and in targeting how to do this procedure effectively and efficiently. With that in mind, the procedure times have been shorter. There's less exposure to radiation. There's more comfort and ease on the operator level, which I think, as a consequence, can potentially lead to a safer procedure. They've never been compared to head-to-head, but this procedure is just as good. As evidence of success, I think most of the centers are starting to use this as their dominant procedure for the paroxysmal intermittent atrial fibrillation. With that in mind, I think it's a must to have it as part of your armamentarium when you're talking about AFib management options, including ablation.
Well, let's talk a little bit about the aging process and why it's so important for those regular checkups. Is there kind of a time frame, or maybe even an age where you really need to be in the doctor's office getting those regular checkups for things like this?
Certainly. I mean, it's hard to pick a specific age, but over, I think, 60 years of age is certainly, this becomes more common. And if we look at just AFib alone, up to 15% of patients aged 80 and above are going to have it. So it's very, very common. And, in probably single percentages in the 60s, but that increases considerably over the next couple of decades. So again, if you do have those risk factors, like I mentioned, and genetics play a role as well, but hypertension, being overweight, alcohol intake, that is going to make it more likely. So that also increases the importance for you to see the doctor more, maybe frequently.
Right, and kind of going back to what you're saying too, it's really valuable to make sure that you're staying healthy with exercise and the right nutrition, hopefully avoiding having to even deal with this. Besides the fact you can't deal with your genetic, I mean, there's nothing you can do about that.
Right.
But, so if someone would like more information, because this can be kind of a complicated process, where could they go? How can they reach out maybe to your office?
Certainly. I believe the phone number is on the screen, but also our website, we have a lot of information about atrial fibrillation, Baptist Healthcare there. And if you go to Heart Rhythm Center, so there's 4 of us electrophysiologists at Baptist Hospital, so we have a wealth of experience among all 4 of us. Again, there's additional information. It is a condition that has to be tailored to each patient, again, because as you can imagine, everyone's going to have a different hue or degree of how symptomatic they are and what their risk tolerance. So it's a must conversation with your electrophysiologist about what to do next.
Fantastic. Of course, this is great information. We really appreciate you coming on the show.
Thank you for having me.